Our work is motivated by the realization that patients with colorectal cancer have different outcomes depending on their race. So it has been known for a while that non-Hispanic Black patients have higher incidence, higher mortality, and lower 5-year overall survival than non-Hispanic whites. And of course, it is largely believed that these differences in outcomes are due to a variety of factors, including many socioeconomic variables, like differences in environmental exposures, differences in access to healthcare, but it is still largely unknown whether or not genomics plays an important role to understand these differences. So we realized that we had a very large cohort of patients that had been sequenced at Memorial Sloan Kettering, mostly as part of their treatment. They had been sequenced with the MSK Impact clinical they had been sequenced with the MSK Impact platform, which is a targeted sequencing assay that looks at DNA alterations in a selected set of genes. So we were able to identify around 4,000 patients that qualified for the study. This included 3,600 non-Hispanic white patients and about 400 non-Hispanic Black patients, and we compared the genomic features in one group versus the other. So we were able to identify some interesting differences, both in terms of clinical variables and in terms of genomic variables. Some of them were consistent with previous reports. For example, in terms of clinical variables, we identified that there was a higher fraction of non-Hispanic Black patients that had right-sided colorectal cancer, the so-called proximal tumors. Then we also found a very interesting difference, because when we focus our analysis on the right-sided tumors, we found that the fraction of patients with hypermutated tumors, including microsatellite unstable tumors and polyhypermutants, was significantly higher in the white patients. It was much lower in the non-Hispanic Black patients. And then we were able also to identify some interesting differences in specific driver genes. So for example, we saw a higher frequency of KRAS mutations among the Black patients, and we saw a higher frequency of BRAF mutations within the set of white patients. And this was even after we restricted the analysis to non-hypermutated patients, to patients that were microsatellite stable. So you might think that, for example, because we see a higher frequency of patients with KRAS mutations within the Black group, this might explain the differences in survival, but this is not the case, because when we restrict the analysis only to patients who are KRAS mutant, the Black patients are still doing worse than the white patients. So in order to look a little bit deeper into this question, we performed a multivariate analysis where we included different clinical variables, such as stage as diagnosis, age, location of the tumor, and even additional elements such as BMI, and then some of the most common driver genes in colorectal cancer, such as KRAS, BRAF, APC, and TP53. And even within this multivariate analysis, this multivariate setting, race was still significant in our analysis of differences in overall survival. So the conclusions that we take from this analysis is that we can find some differences in genomics between the non-Hispanic white patients and the non-Hispanic Black patients, but these are not enough to explain differences in survival. We believe that these differences have clinical and translational relevance, but they are not enough to explain why non-Hispanic Black patients are doing worse. So again, we go back to this idea that this is probably a multifactorial event, and then there are other socioeconomic factors that are very important and explain the difference.